So you're coming in muted. Just want to let you guys know. So I'm Marion Ross. If you don't already know me, I am the business development person for Northern California here at Evolve Treatment Centers. I am so excited to give you the what's what and what's new at Evolve in Northern California. I know that most of you know that we have facilities in both Southern and Northern California, but today it's all about what's new. So some of the sort of housekeeping things I would want to let you guys know is when you chime into this webinar, you will be muted. There is a Q&A section at the bottom for any questions. A couple of our panelists will be answering questions by typing, and then I'll be going through the questions at the end live to answer some of those. What's going to happen today is we're going to be introducing you to all of the program directors that you may or may not have probably met in Northern California. So we're really excited to show and highlight them and what they do and what their passion is at each program here at Evolve in Northern California. So, and then we're going to be stepping off and our newest program director, Sean Rowland, LCSW here at Danville PHP-IOP. She will be taking you on a virtual tour of our newest site. So we're really excited to finally have these doors opening here in Danville. Having this whole continuum of care is really a good thing here in Danville. So, we've had this space for a little over a year, and because we know what we've been going through with the pandemic, we're finally able to build it out and to build this space and to open. And our first client is coming in tomorrow, and Sean Rowland will talk a little bit more about that. I do want to talk a little bit about, just for a couple minutes, we did have a ribbon cutting ceremony a couple of weeks ago, earlier in April. I think it was on the 19th, when we had to have a social distance ribbon cutting. The town of Danville was very gracious. They made it very wonderful for us to have this special moment. We had assemblymen, we had the chief of police who gave a phenomenal, heartfelt speech. We all stood in our large group room. You can see during the tour, the chief of police walked up in the middle and he put his hands on his chest. And the first thing out of his mouth was, "What do I do?" And then he said, that's the question that he hears from families in the community all the time. What do I do with my teen struggling with substance and mental health? And it was just a wonderful, heartfelt speech. And the mayor, Renee Morgan, she stood up and said that she was so gracious and happy and grateful that we chose Danville out of all the locations in Contra Costa County to place our outpatient program. So we really want to have a heartfelt thank you to the town of Danville for greeting us with open arms. We're just really grateful for that. On another note, before I move into Sean Rowland giving her tour, I also want to just give a heartfelt note to any of you who have had either family members or friends or neighbors who have suffered through this pandemic, whether it be through a loss or have gotten sick. I just want to give a heart, just reach my heart out to you guys, because I know quite a few families who have suffered through this, including some of my own. So just mwah to you guys. Okay, so with all that said, okay, so what we're going to do now is I'm going to introduce Sean Rowland. She, like I mentioned before, she's our newest hire. She is an LCSW. She comes from a nonprofit background. She has wonderful experience working with youth, and we're so grateful and so gracious to have her here working with us here at the Danville Outpatient Program. So Sean, are you ready for your tour? You're on mute.
Hi, I'm Sean Rowland, LCSW, Clinical Program Director at Danville. Welcome. Can't wait to show you our space. So when our clients come in the morning, their first stop is the front desk. The first thing we do is give them a warm welcome. We want our youth to feel welcome. We want them to feel like they're special. And that's the most important thing we do at the beginning of the day. The next thing we do is a COVID screening, and that includes taking their temperature and asking them those key questions, and then of course, sanitizer. Next step is to go over to the lockers. In the lockers, we put their electronics, because as you know, when there's electronics, it's hard to stay focused. So that's quite a step, and of course, sometimes that doesn't go over very well, but it's really important that our kids are able to stay focused. We also check them for sharp objects. We want to make sure that they stay safe, and so we make sure all the sharp objects are taken care of prior to entering the next part of our program. So come on down to the next step of the tour. This is the chill zone. So we have the super chill zone over here where the youth can sit on pillows, hang out, and just do the super chill. And then we have the other chill zone where the youth can sit on the couches, they can listen to music, they can hang out and chat. This is just a really nice place for them to relax because they spend a lot of time learning and growing in our groups. And we want to make sure that they have downtime because as we know, learning can only happen when you have time to really sit and relax and take it in. Now we're going to go check out the offices, starting with mine. So here's my office. We're going to move on out of my office. So many things happen in my office. I do individual therapy, family therapy, group therapy, meet with my staff. Some of the groups that I run myself are art therapy, multifamily therapy, and DBT. So I keep pretty busy with doing direct service, management, and just keeping things running overall. We're going to go on to the next office now. This is Stephanie Badisco. We're just going to go in a little bit here. Stephanie is an absolute rock star. She has so many responsibilities. She starts her day with welcoming our youth into our education program, which goes from 10 to 12. First, she checks in to see how they're doing emotionally, because we need to make sure that they're checked in on and they're doing okay. We hope that they come in doing all right. But if they're not, we have myself as a therapist and our primary therapist to support them if they need additional support, because we want to make sure that they can focus and be ready for the day. And over here we have Ian Rosenthal. He's our primary therapist, and he does groups, individual therapy, and family therapy. Some of the groups he runs is mindfulness, and then he does a number of DBT groups. And the DBT groups are basically strategies for our youth to be able to manage the challenges in their lives. Basically to deal with emotional deregulation. We want them to deal with all the difficulties that they have to handle. We have kids who are suicidal. We have kids who do self-harm. And those are huge challenges for these young people. And so we basically help them with evidence-based practices to have skills to manage those difficulties so that we can move forward so they can live healthier lives. We're now going to go into the schoolroom. But as we walk towards the schoolroom, I'm just going to point out some offices down the hall where we have our psychiatrist and utilization review. This is the classroom. So this is where Stephanie spends her morning with our youth. And as I mentioned before, the first step is to check in on them, see how they're doing emotionally, see if they need any additional support. And then the focus is education. As we know, education is a big part of being young, and it's a sense of how you feel secure, feel good about yourself, and have a sense of accomplishment. So we want to make sure we support their education, and even though treatment is the primary focus, we want to make sure that they're not falling too far behind in their education. This is our group room. They spend a good part of their time in the group room, and we have a wide variety of groups. So in the morning, the PHP clients arrive at 10 a.m. and they have groups such as self-esteem, CBT, and they do art, they do a whole variety of things in the morning. And then they have lunch. And then at 2:30, they actually travel home. And so the PHP are basically like in person up until 2:30. They travel home, and then we start virtual groups from 3:30 until 6:45. Our IOP program, or intensive outpatient program, is all virtual at this point. We can't wait till they're in person again, but right now they're virtual. And so they go from 3:30 to 6:45, and they join the PHP. So the virtual program is actually a combination of the PHP partial hospitalization program and the intensive outpatient program. And we have such a range of groups during that program. We have DBT groups, dialectical, anyway, DBT groups, and we have drama therapy, we have music therapy, and then we have one of the most important groups of the week, which is multi-family therapy. That's a group that I run, where we bring all the families together, and by bringing all the families together, they are able to see that they're not alone, that other families are struggling with the same things. They come up with ideas for each other and just have that mutual support that is so important. But one of the real core parts of our program is DBT, dialectical behavior therapy, and that's really where they get these core skills. So what we see in our program is a lot of the youth who come to us come without any skills, so they just suffer through these difficult emotions. And when they, after a few weeks in the program, they start to build skills, and they start to really have options of what to do when they have distress, and be able to move out of those stressful feelings and really make changes in their lives. So that's it for the tour. I will meet you later in my office. Thank you for joining us.
Thanks so much, Sean. And thanks you guys for joining us. For those of you who chimed in a little bit late, I just want to thank you and welcome you for taking time out in your day. Yeah, so we put Sean on the spot, and so it's a little nerve-wracking trying to do a tour for the first time, second time. So, you know, I appreciate you guys bearing with us, and she did a fantastic job. I just want to commend her for that. So thank you so much again, Sean, and we will get back to her. And don't forget, if you have questions, we are looking at the Q&A there. Thanks, Christine. I see you said we have a beautiful space. I can't wait till you can come over and see us in person. So I'm now going to introduce Alexa Beaufoli, and she is our program director at Danville RTC. We are so lucky to have her. She's been with us since we opened in Danville. Gosh, was that like
2 years come October? Yeah.
2 years ago. So we are really grateful to have her on board here. So take it away, Alexa.
Thanks, Marion. Nice to meet everyone. Thanks for participating in this webinar and the tour. I can speak for a lot of the other RTCs in the East Bay. We are super excited for a PHP to open in the East Bay. Yeah, so Danville, like Marion was saying, we opened, 2 years in October, which is really exciting. And then since then, we opened up an RTC in Walnut Creek and in Lafayette. So, you know, obviously we're a high level of care. Our admissions team will go into a little bit about how we structure our program. So I won't talk too much about that. But obviously our job at RTC level is stabilization and safety. So we really target these clients coming in and their families who are in crisis. Our goal is to stabilize them, increase effective communication, work on psychoeducation as far as what's going on with them and their struggles, and provide some coping strategies so that they can then seamlessly kind of reintegrate back into home. That being said, this PHP in the East Bay is so necessary. And one reason I'm really excited that it's an evolved facility is the step down and continuum of care makes it so effortlessly for us. We are really big in collaborating and communicating. So what we do at the RTC level, having a nice landing pad of a PHP with the same type of DBT core interventions that we use at RTC, the treatment plan, the interventions, it goes right down into lower levels of care. So yeah, I'm just really excited to have them open and collaborate with them and have it be really a seamless transition for clients and families back into the community. And if anyone has any questions for me as far as RTC stuff, feel free to ask in the Q&A, and I will stick around and answer any questions. Thanks, Marion.
Thanks, Alexa. Thank you so much. We're so grateful to have you. And now I'm going to introduce Devon Corpus. She is another new addition to the Evolve Northern California centers. She now is in charge of our Gilroy program. We're so grateful and happy to have her here. Take it away, Devon.
Hi, thank you so much. So here in Gilroy, we are just at the south end of Santa Clara County, and we're just north of Monterey County. So we're in a beautiful spot here in Gilroy. The weather is super nice, and I really love this location because I think it's such a great therapeutic place for our clients to just get well. Our clients, just like Alexa said, we have the same mission as far as a residential treatment center, helping these clients, build lives worth living. I have 24 plus years in the mental health field. I have a lot of background in working in hospitals and in crisis situations. And I'm really excited to be a part of this Evolve team. I really love the structure of the programs. I'm also prior military. I was in the Army. And what that says about me is I like when things are uniform. And, whether you're here in Gilroy or in Danville or one of the other locations down south, you're going to see some uniformity in the programs and the structure. What are the core groups that are offered? So that way, we are all on the same page. Nobody's going rogue. And, we are offering evidence-based practices as treatment to our clients, which is the best way to ensure that they're going to get healthy and that families will feel a lot better about how to handle crisis situations. So I'm just really excited to be a part of the Evolve team. And I will also be sticking around if anybody has any additional questions for Gilroy or anything else that I can answer.
Thanks, Devon. Appreciate you. Okay, and next up is our beautiful Larissa Carvon. Larissa is our I love you, girl. She's our program director at San Jose Outpatient. Larissa has been with us since October of 2020. And usually you guys who have attended my spotlights in the past, you know that I've had them in person at our San Jose office. And since the pandemic, we've had to, axe all of that. And Larissa, our previous program director, Ashley Thomas, she decided she found the love of her life and she moved to LA. And now she's our program director at our Woodland Hills house. And she recommended Larissa, and we are so happy that she did because Larissa has done a fantastic job. And some of you have kind of met her. She was able to come on to my annual tea party, which most of you ladies, if you have been working with me throughout the year, you get an invitation to the annual tea party. It has historically been in person, but this past year we had to have it virtually. And I tried to make it super fun for you guys. And Larissa showed up and she had her beautiful tea hat. And it was just phenomenal for the ladies in the community to be able to meet her, even though it was virtual. But here we are again, still virtual. So Larissa, I love you so much, and you take it away, girl.
You're too kind, Marion. Thank you. My name is Larissa Carvon. I am an LCSW, and I have a background, a very heavily based school-age population background, but I've also worked in health clinics and with adults. My heart is with the kids, though, and that's what drew me to Evolve, and that's what provides my day-to-day excitement, is just working with these teens and families during what is such a crucial time, in addition to just adolescence overall, just dealing with mental health and or substance abuse issues. So I'm really glad to have the opportunity to provide support in such a great organization. We are located in Santa Jose. It's the border of San Jose and Santa Clara near Valley Fair Mall. And pretty much everything that Sean explained is happening at Danville is what we are doing in San Jose. Our PHP program is 10 to 2:15 on site, and then our virtual program is 3:15 to 7. And we do provide, the DBT, CBT, life skills groups. My staff consists of 2 primary therapists, Angela Hickenbottom and Monica Ippolito, and they are both LMFTs. I have our facility manager, Leslie Miranda, and our floor counselor, Lupe Villa, and just my team is amazing. I cannot express enough how amazing these women are. And I'm just so grateful to be able to provide services alongside this group of people. And so we all just really have a heart for supporting the families and the clients during this journey of treatment, and echoing what Alexa expressed about the transition from RTC to PHP. When it's, in the Evolve family, it makes it a lot easier because a lot of the skills are kind of just, transferred over, and we're working on continuing to build or maintenance. And then, just working with other agencies, community agencies, and children and family from the community as well. So it's a great place to be. And I think on both sides to work and to, be able to have to support you. And I'm just really excited to continue working with the families that we have. And I too will be available after for questions. And thank you.
Thanks, Larissa. Thank you so much. So I do want to just touch on really quick what Larissa said. She talked about the passion for the work. And the one thing that I love about Evolve Treatment Centers is that everyone that I have come across who works in this field, whether it be a clinician, whether it be business development, whether it be our counselors here, they all have a passion and a desire to work with this population. I take us in the business development team take calls every day, talking with families, about what can they do, what support can we provide for them, and a lot of times when I find myself being a resource, and not all the time it's to Evolve Treatment. It's just about being a resource to that family, to the best fit for them. It could be depending on their resources. It could be depending on the facility. It could be depending on level of care. But honestly, the desire and the passion to work with this, youth with mental health and their families, you just have to have, it in you in order to really want to work here. And that's why, we all work here. And I really appreciate you, Larissa, for touching on that, and everyone else who did as well. So with that, we're going to cut over to our wonderful admissions director. She was also an LMFT, Megan Johnson. So most of you have already met Megan Johnston. You may already have a speed dial with Megan on your phone because she does collaborate on cases with a lot of clinicians before we even accept a case or do an assessment. So Megan is going to just go through a really quick slide deck about how to contact us, and a little overview that you may or may not have heard. So I apologize if some of this stuff feels repetitive, but here we go. Thanks, Megan.
No problem. Thanks, Marianne, and hello to everyone. So I quickly just want to go over a little information about Evolve, who we treat, a little more about the structure of our program, and what our admissions process looks like. So here is our clinical leadership team for Northern California. We have Dr. Verma, who is our medical director, and also our psychiatrist that sees all of our kids in Northern California. She's fantastic. We love her. And we have a lot of other supports as far as clinical and all things operational, both at the residential and outpatient levels of care. So Evolve is just for adolescents. We are specifically designed to treat 12 to 17-year-olds. We're also a dual diagnosis program, meaning we treat kids struggling with mental health issues behavioral health issues, and or substance abuse issues as well. So as you've seen kind of throughout this webinar, we do offer the continuum of care, which is so great about Evolve. We have the residential program, PHP, and IOP options. This is a list of all of our locations. So we are only in California. For residential, we have 4 options in Northern California and 7 options in Southern. And then for PHP IOP, we do have our newest Danville location, which we're so excited about, and then San Jose, as we just learned about, and then San Diego and virtual. The great thing about our virtual program is that we're able to help any kiddo that resides within the state of California, since it's all online. So Evolve does utilize quite a few different types of therapeutic approaches. I think as we heard a little bit about, we mainly are utilizing DBT. That's definitely our strongest modality within Evolve, although we do incorporate other approaches as well. All of our Northern California locations are considered DBT informed. We very commonly have parents and other clinicians that are reaching out to us specifically because DBT is recommended for that child. So at any one of our locations, the kiddo will get a good dose of DBT. We do have the ability to offer a comprehensive DBT program as well. This is our residential program in Tarzana, which is in Southern California, our Van Alden location. It is fully comprehensive, so we're really excited to be able to offer that also. Here's a little information about how our residential programs work. We have a maximum of 6 kids at each of our facilities. So it's a really small, intimate setting. There's a 3-to-1 client to therapist caseload, and there's also a 3-to-1 staff to client ratio. So there's 3 clients per therapist, and there's also 3 clients per staff member, just when it comes to supervision. That 24-hour supervision and support is really important to us. Even overnight, we have 2 staff members that are checking on the kids all night, every 15 minutes. The length of stay in our program typically is about 30 to 60 days. Of course, every kid is different and it can depend on a variety of factors, but typically we're seeing kids around that 30 to 60 day mark. We treat all genders. So our programs are co-ed. We treat boys, we treat girls, we treat kids identified as transgender. We treat kids that don't know what gender they identify as. We accept everyone at our program. Everyone is welcome. Each kiddo gets 3 weekly individual therapy sessions. So they're meeting with their therapist 3 times weekly individually. They're meeting with their therapist twice weekly for family therapy. And Evolve puts a very heavy emphasis on the family involvement in the program. We feel strongly that that really indicates how successful our program will be for a kiddo, is really how much the family is involved throughout the whole entire process. We have a psychiatrist that meets with our kids weekly, every single week for medication management. There are a variety of group therapies every single day. We also provide time Monday through Friday for schoolwork. We actually, in all of our programs, have like a separate school room for kids to go to so they can actually feel like they're separating their day off and now it's time just to focus on school. We have the ability to offer one-to-one patient monitoring if that's needed. If there is a safety issue that comes up, we do have the staffing to be able to watch that client on a one-to-one basis. All clients also enter our program on a one-to-one monitoring, just as we're getting to know them and kind of assessing exactly how safe they are. And then we have on-site nursing every day as well. So a little more about those group therapies. We offer quite a bit of experiential therapies at Evolve. We did develop this program specifically for adolescents. So we not only wanted to find things that would interest them, but also potentially expose them to a new passion, a new coping skill, a hobby that they might not have otherwise had the opportunity to experience. So we're doing things like art therapy, music therapy, drama therapy. We do equine therapy at all of our locations, which is therapy with horses, which the kids love. We're also all about getting them up and moving and getting their bodies moving. So we do yoga, we do hiking, we incorporate all of that at all of our residential locations. So here's a little more about our outpatient programs. As I mentioned, all 4 of our locations do both PHP and IOP. At Danville, San Jose, and San Diego, our partial hospitalization program is a hybrid model currently, meaning that the first half of the day is in person, and then the second half of the day, the kiddos go home and finish out the day virtually. That second half of the day is also our IOP program. That's when our IOP kids join. So for PHP, it's a full day of programming Monday through Friday. For IOP, it's really kind of like an after school program because it doesn't start until the evening, and it's typically about 4 days a week. And in both of these programs, either PHP or IOP, kids are getting individual therapy weekly, family therapy weekly, psychiatry weekly, and then group therapies every day. A little bit more about that parent and family participation. All of our programs do have at least one family therapy session weekly. That includes the parents, the teenager, and the therapist. In our residential programs, we provide that additional family therapy session that's just the parents and the therapist alone. And so a lot of coaching often takes place in those sessions. In our outpatient programs, we do have that weekly multifamily group, which is all parents and all kids, which is great. And then we offer parent support groups as well as parenting workshops. And there's more information can be found on these two on our website. So make sure to check that out. And then as far as our insurances, we are in network with Anthem Blue Cross Blue Shield, and Health Net. We are able to work on an out-of-network basis with quite a few other private insurances. And in some situations, we're able to request single case agreements as well. So if you ever have a specific question, if you have a kiddo that you're wondering if it's an insurance we can work with, definitely feel free to give us a call. It's free for us to do a benefit check to find out not only can we work with this insurance, but how much the family will be responsible for. And lastly, this is just a little flow of what the admissions process looks like. The best way to start the process is just to give us a call. We are happy to answer any questions you have, any questions the family has. We will, tell you whatever you need to know about Evolve. We want the family to feel fully comfortable with whatever decision they're making. So we want to feel they have all the information that they need about our program. We will go over money. We will go over the insurance right from the start. We want to make sure we're super transparent and super upfront with parents when it does come to that piece. It's not something we want to introduce way down the line of the admissions process. We go over it right from the start, no secrets there. And then the next step is assessing and making sure that Evolve is going to be a good clinical fit for the kiddo. And Evolve puts a really strong emphasis on this piece. Because we want to make sure that we can effectively treat the child. So we do an assessment with the parents, we assess the kid themselves, we're collecting records as far as if they're coming from a hospital, we want records, another treatment center, if they have an IEP through school. We really want to gather as much information as we can to help determine whether or not Evolve is a good fit. And then should all that work out, depending on availability, we go ahead and schedule the assessment. And I think in both cases for our outpatient program and our residential program, assuming there is a spot available, this whole process can happen fairly quickly. It kind of just depends on what's going on clinically and specifically with that situation, but there have been many times we've been able to get kids into our program pretty quick. So that's fantastic. And we have our phone number up here. It's also on our website as well. But that's pretty much it as far as admissions.
Thanks so much, Megan. Appreciate that. And thanks to you all today. So this is the time we're going to ask, we're going to start responding to some of the questions. We've actually typed a few questions back to folks. One of the questions was, are we in network with Blue Cross? And you got the answer there on the screen. We are in network with Blue Cross, pretty much all the Blues, and then Health Net. One of the next questions is, how many teens can you accommodate? So it depends. So at our residential programs, we have 6 beds. So we accommodate 6 kiddos at each residential. And then I'm fairly sure that in our outpatient PHP programs, it's based on how many primary therapists we have. But Megan, if you want to answer that, or Larissa, how many kids can we accommodate at our PHP or IOP programs?
At our Center for PHP, due to the pandemic, we only have a maximum of 5 clients on site to be able to maintain the social distancing protocols. For IOP, there can be a little more since it's virtual, but our census is usually between like 10 and 11 clients with both IOP and PHP.
Okay, thank you so much, Larissa. And then the next question is, are all of our locations in network with insurance? And if so, which ones? So we did answer that question. And if so, which one? Megan, do you want to respond to which locations are in network?
Yes. So all of our locations are in network with Anthem Blue Cross Blue Shield, and Health Net, except currently our new Danville PHP is not in network yet, although they will be soon. And then our newest residential location is in San Diego. It's our Mount Helix location. And it's just because both of those programs are so new, we're going through the process of becoming a network. So it hasn't happened quite yet, but we will be.
Carve has to come through and do their walkthrough and all that. Is that right? Is that how that works?
It's a process with the insurance company, but we're actively working on it.
Okay, perfect. And then the next question is, good afternoon. What is your estimated timeline for RTC for clients with substance abuse? Do you work with transitional living for teens and when the clients aren't local in the IOPs? Who wants to take that question?
I can take the question regarding, the question was a wait list, like how long is the wait for residential? Did I get that right, Marion?
What is your estimated timeline for RTC for clients? Yes, with substance abuse.
With substance abuse.
Specific.
So it does always change. It's hard for me to say, I can tell you what it is in this exact moment, but I would say give us a call if you have a client or a family looking, and that's information we can give you right away. Typically, we don't have a very long wait, considering for residential, we have 11 different locations. We do have the 4 in Northern California. So we're not one of these programs that have like several month waiting lists. So typically within a week or so, if not immediate availability.
And I think the only other thing that I'll add, sorry, Megan, Marion, is for timeline for RTC when it comes to if someone's coming in with a substance use disorder, the timeline is very similar to if they're coming in with a mental health disorder. So it depends on the client, it depends on the presenting issues and what does the step down look like, because we're actively always kind of working on the next step so that there's no lapse in care. So I would give it again 30 to 60 days on average, but it totally depends on the client.
Thanks, Alexa. And then the second part to that question is, do you work with transitional living homes? And Noah, I know why you asked that, and you know which program we work with on transitional living. So don't be trying to trick us. And then the last statement is, I just referred somebody to do your PHP program this morning. So thank you so much for that. Let's see if we have any other questions. Let me see. I think that is it. No more questions. Going once, going twice. Oh, here's one coming up. Do you work with eating disorders?
I can take that one. So we're not a primary eating disorder program. So if it's really clear that the kiddo needs a strong eating disorder program, unfortunately, that isn't us. If there are some disordered eating patterns that are really secondary to depression or anxiety, that is something we can handle, but we just want to make sure that client wouldn't be better suited at an eating disorder program.
Go ahead, Alexa, you want to comment to that?
Yeah, similar to what Megan's saying, I think for us, we want to make sure that the primary concern that we're treating is the mental health and or substance use disorder. Oftentimes people are coming in with disordered eating or carrying a diagnosis. We just want to make sure that it's secondary or related to the primary concern that we're trying to target.
Great. Any more questions? There's another question. Let's see. Do you currently have a wait list for the PHP and IOP in Northern California?
At San Jose, we currently don't. We have openings, but that changes rapidly. So it's just dependent on how quickly an assessment is completed and then the level of care is determined. And
Right now for both San Jose and Danville Outpatient, we do not have a waiting list currently. But again, as Larissa said,
We just opened in Danville, and Sean could attest to this. She's so excited about having her first client tomorrow. Woohoo! So send them on over, folks. Any more questions? All right, we really want to thank you guys for taking time out of your day today and chiming into yet another virtual event, which I just want to like, So, so you guys have a great afternoon, have a great Mother's Day, and stay safe out there. Thank you.